It's been a year since I was diagnosed with diabetes. When people found out that I have diabetes or when I tell them that I'm diabetic, I sometimes hear them saying, "Oh, you like to eat sweets, ah?" This is a very common notion about diabetes. People normally associate it with sugary foods or eating too much sweets, chocolates, cakes, etc., but there's more. Diabetes is a condition associated with high level of blood sugar. Contrary to popular belief, sugary foods are not the main reason for having diabetes. However, it can be a contributing factor as it is linked to weight gain or obesity, which is one of the causes of having diabetes. There are other aspects that lead to diabetes, such as it can be hereditary, it can be due to age, or it can be due to an autoimmune disease like mine. What happens is that when we eat, the food is digested and the carbohydrates turn into sugar or glucose for our body to use for energy. Glucose enters the bloodstream, then the hormone insulin moves the glucose from the blood into the cell where it is used for energy. The problem with people with diabetes is either they are not producing enough insulin or the cells of the body does not respond to the insulin produced, which creates high blood sugar level. The most common type of diabetes is type 2 diabetes. In this type, the pancreas produces insulin but the body cannot use it effectively. It is called insulin resistance. Genetics play a part, but type 2 diabetes can be prevented by living an active and healthy lifestyle. Type 2 diabetes is more likely to appear as people age, but some children are now starting to develop it due to obesity. Sedentary lifestyle and excessive eating have great impact on the development of type 2 diabetes. On the other hand, type 1 diabetes is an autoimmune disease. It is a condition in which the immune system mistakenly attacks the body instead of protecting it from viruses and bacteria. There are many types of autoimmune diseases depending on which part of the body is destroyed by the immune system. In type 1 diabetes, the immune system destroys the beta cells that make insulin in the pancreas. People with type 1 diabetes have little or no insulin. It is still unknown why the immune system attacks the body by mistake. Type 1 diabetes cannot be prevented. It is not related to lifestyle or diet. It is usually called juvenile diabetes as it is usually diagnosed in children and young people. However, it can develop at any age. Misdiagnosis in adults can be rampant as they are usually mistaken as type 2 due to age. I have type 1 diabetes and I never thought I would have this condition because no one in my family has it, and I have a healthy weight and I have been doing exercise prior to my diagnosis. Another type of diabetes is gestational diabetes. A woman without diabetes may develop high blood sugar levels during pregnancy. Gestational diabetes often goes away after giving birth. Type 1 and type 2 diabetes have similar symptoms such as increased tears, frequent urination, extreme hunger, fatigue, blurry vision, and an unexplained weight loss. Type 1 diabetes also have presence of ketones in urine. Symptoms of type 1 diabetes develop quickly in a matter of weeks. It took me 3 months before I consulted a GP because I became underweight even if I was eating a lot. I was also extremely lethargic. On the other hand, symptoms of type 2 diabetes often develop slowly over the course of several years, to the extent that some people might not notice it until complications arise. That's why it is important to go for a regular health screening, especially if you are an adult, to know your health status. Prediabetes is a condition in which the blood sugar level is higher than the normal, but not high enough to be classified as diabetes. It is reversible by managing weight, eating a balanced meal, and staying active. If left untreated, prediabetes often progresses to type 2 diabetes. Both types of diabetes can lead to complications that may damage internal organs. Diabetes is incurable but manageable. Proper management of both diabetes include constant monitoring of blood sugar level, proper diet, and healthy lifestyle. Management of type 1 and type 2 diabetes may differ. Type 2 diabetes is insulin resistant and is managed through oral medication, Over time, the cells that make the insulin in the pancreas will be damaged, which will eventually may not be able to produce enough insulin. So some people with type 2 diabetes take oral medication and insulin injection to manage it. Type 1, on the other hand, is insulin dependent. We rely on insulin which we inject or through the use of insulin pump. Insulin cannot be taken by mouth because it is digestible. The stomach and the intestine will break it down before it has a chance to go to the bloodstream to do its job. Type 1 diabetes count the amounts of carbohydrates in foods to inject the right amount of insulin to prevent high blood sugar or low blood sugar level.